Well, today I want to talk a little bit about Eastern Equine Encephalitis, or Triple E. And up north in Massachusetts, they've been hit pretty hard with Triple E cases in humans this year. And this is from the Massachusetts Department of Health. And they're saying, this is from Friday, they laboratory confirmed 2 new cases of Triple E, a woman in her 60s from eastern Worcester County, and a female under the age of 18 from southwestern Middlesex County. This brings the total number of human cases of Triple E to 7 this year in Massachusetts. So they raised the risk level in many of these areas to critical, like Framingham and Marlborough. In addition to the human cases, they've also seen 9 animal cases so far, 8 in horses and 1 goat. And the Public Health Commissioner, Dr. Monica Barrell, says even though temperatures have cooled off, it is not unusual to see human Triple E cases confirmed in September. This is why we continue to urge the public to take seriously the threat that mosquitoes can pose and to take steps to avoid being bitten. So a little history about Triple E in Massachusetts, which is in recent years, other than Florida, has seen the most human Triple E cases. Triple E is a rare but serious and potentially fatal disease that can affect people of all ages. We're going to talk more about pathology soon. Triple E occurs sporadically in Massachusetts, with the most recent outbreak years occurring from 2004 to 2006 and 2010 to 2012. There were 22 human cases during those 2 outbreak periods, with 14 cases occurring among residents of Bristol and Plymouth counties. And coming back to 2019, health officials also say Triple E virus has been found in 400 mosquito samples this year, many of them from species of mosquitoes capable of spreading the virus to people. So that makes me go to this letter from the 2 Massachusetts senators, the U.S. senators, Ed Markey and Elizabeth Warren, and they sent this letter to the National Institute of Allergy and Infectious Diseases Director, Dr. Anthony Fauci, on Friday. And they write, "Dear Dr. Fauci, we write to inquire about research efforts within the NIAID, and particularly the Laboratory of Malaria and Vector Research for Eastern Equine Encephalitis virus. Massachusetts has seen a disproportionately high number of Triple E cases since 2009, second only to Florida. Outbreaks of Triple E in Massachusetts appear to be cyclical, occurring every 1 to 2 decades and lasting for several years at a time." They go on to say, unfortunately, there is no treatment for Triple E. And just to prevent Triple E transmission is to protect yourself from mosquito bites. And then it goes on to say, and this is really the crux of their letter, "To help us better understand the current state of federal research on Triple E, please provide an update within 15 business days of existing federal research activity on the disease. In addition, we request information on whether research into other vector-borne viruses could be applicable to a better understanding and treating this elusive infection." And again, that's from Senators Ed Markey and Elizabeth Warren. Now, if we go next door to Rhode Island, they actually saw a Triple E death very recently. And it says the Rhode Island Department of Health said a person infected with Triple E virus in West Warwick has died. This individual was in their 50s. The person was first diagnosed on August 30th and passed away on Sunday, September 8th. The death is Rhode Island's first human case of Eastern Equine Encephalitis since 2010, and the first fatal human case since 2007. So, and I think Massachusetts has reported at least 1 fatality. that I'm aware of. Okay, moving right along. And it's not just the Northeast that's experiencing some triple E activity. In the state of Michigan, in Kalamazoo County, they're warning residents about the threat of triple E, and so far they have seen 3 confirmed human cases in Michigan, 2 in Kalamazoo County and 1 in Berrien County. One of the confirmed individuals from Kalamazoo County has died. In addition, there's 2 other suspected human cases, 1 from each county. And then there's 2 other additional cases that are being under investigation in Kalamazoo County. So there's a lot of activity going on up in Michigan also. So we'll be keeping an eye on that. Okay, and then back in mid-August, we had this report from the New Jersey Department of Health. Yeah, New Jersey Department of Health. And they reported the first human Eastern Equine Encephalitis case of the summer in an elderly Somerset County man who was hospitalized and has since been discharged and is currently in rehabilitative care. And according to health officials there, triple E has been detected in 22 mosquito samples and in 3 horses in the southern eastern parts of the state. Okay, so let's learn a little bit more about Eastern Equine. It's a virus. It's a member of the genus Alphavirus of the family Togaviridae. Other medically important alphaviruses found in the Americas include Western Equine Encephalitis and Venezuelan Equine Encephalitis. Triple E virus is a single-stranded positive sense RNA genome. The virus particles are spherical, as you can see in the picture on the right, and have a diameter of about 60 to 65 nanometers. There are 4 lineages of triple E virus, and group 1 is endemic in North America and the Caribbean. And the other 3 groups they cause primarily equine illness in Central and South America. Concerning transmission, transmission is maintained in a cycle between various mosquitoes of Culiceta, Culex, and also sometimes in Aedes. These mosquitoes and avian hosts in freshwater hardwood swamps. The Culiceta species is an important vector between mosquitoes and the avian host. However, not such a big vector to transmit to humans, and that's where the transmission from other mosquitoes like Aedes and Culex come into play. The transmission to humans require mosquito species capable of creating a bridge between infected birds and uninfected mammals. And in addition to humans, of course, hence the name, horses. Horses are susceptible to triple E virus infection. In some cases are fatal. Triple E virus infection in horses, however, are not a significant risk factor for human infection because horses, like humans, are considered to be dead-end hosts for the virus. And let's go ahead and talk about symptoms and treatment real fast, because this is a very dangerous virus, though. The incubation period for triple E ranges from 4 to 10 days. Triple E virus infection can result in one of 2 types of illness: a systemic or encephalitic infection. The type of illness will depend on the age of the person and other host factors. It is possible that some people who become infected with triple E virus may be asymptomatic. Systemic infection has an abrupt onset and is characterized by chills and fever, malaise, joint pain, muscle pain. This can last about 1 to 2 weeks. Recovery is complete when there is no central nervous system involvement. Approximately a third of people with triple E will die from the disease, however. Death occurs between 2 to 10 days after onset of symptoms, but can happen much later. So it can be a very serious disease with a fatality rate in humans of somewhere in the ballpark of 33%. Okay, let's check out some data. And now, this is not a really common virus, right? And it says here, human triple E virus cases occur relatively infrequently, though we are seeing quite a few cases this year. And this is because the primary transmission cycle takes place in and around swampy areas where human populations tend to be limited. All residents of and visitors to areas where triple E virus activity has been identified are at risk of infection. So people who engage in outdoor work and recreational activities in endemic areas are at increased risk. People that are over 50 and under the age of 15 are at the greatest risk of severe illness with triple E. Overall, only about 4 to 5% of human triple E virus infections result in Eastern Equine Encephalitis. The virus, if you get infected with this virus, it is thought to confer lifelong immunity against reinfection. And it does not confer any significant cross-immunity with some of its related viruses like Western equine, and none against the flaviviruses like West Nile virus. In the U.S., an average of 7 human cases are reported annually. Most of the cases have been reported from Florida, Massachusetts, New York, and North Carolina. And as you can see in this chart, these are the number of triple E cases, neuroinvasive disease, during the past decade or so. And last year there were 6, and we see a peak of 15 in 2012. And we see that same stuff here. And here's a map and gives you an idea that it's primarily disease of east of the Mississippi. And you can see, again, Florida, Massachusetts with 10, New York with 8, North Carolina with 7, and Michigan are 7. These are the primary states for triple E virus infection. Now, speaking of Florida, just want to take a look at the latest arbovirus surveillance report. This is going through the end of August, so the first 8 months of the year, and we can see the triple E activity right here. No human cases of triple E infection were reported this week, and there has been no human cases this year in Florida. 1 horse with triple E virus infection was reported in Putnam County. 2 sentinel chickens. Anyway, to get to the main crux of it for 2019, we see positive samples from 26 horses, 1 emu, 1 eagle, and 98 sentinel chickens from 29 of Florida's 67 or so counties. So far, there's been no human triple E in Florida this year. And let's go ahead and take a look at some of the pathology in horses, right? Eastern Equine Encephalitis in horses. And it's a viral disease of horses that involves transmission between birds or rodents and mosquitoes. Most commonly seen in horses in the southeastern U.S., with several hundred cases reported each year, and there's a lot this year. Most horses develop disease are young and unvaccinated, but certainly vaccinated horses can also develop the disease. A major pathogen this is. Up to 90% of horses infected with triple E will die. And then they also recommend here that you should contact your veterinarian immediately if you notice any of the below clinical signs in your horse. Neurologic horses can become extremely dangerous to be around, and caution should be taken while attempting to care for these animals. Treatment is supportive care, IV fluids for the dehydration. Unfortunately, the prognosis for triple E in horses is very poor, as we already saw. Once a neurologic horse loses its ability to stand on its own, the prognosis becomes poor for survival. And these are some of the clinical signs in a horse. and it's usually quite progressive. So you have this biphasic fever from day 2 to day 6, stiffness, hypersensitivity to touch, aggression, excitability, head pressing, wandering, constant chewing, recumbency, and death. And unlike for humans, there is a vaccine for horses. So if you do have a horse and you're in one of these areas, you should definitely consider triple E vaccine for your horse. So triple E's really caught some media attention, particularly what's going on in Massachusetts, which has seen 7 cases so far this year. And according to the CDC, that is the average number of cases annually in the country. So Massachusetts has taken a big brunt this year, and some other states, Michigan and some other northeastern states. Okay, well, I hope you enjoyed this. I hope it was informative to you. Go ahead and comment below, share it with your friends, like the video, subscribe to the channel, and I'll see you next time.